Hello, my name is Charlotte Jarrett. I am a family nurse practitioner in the state of Florida in Broward County. I work as a nurse practitioner, which is a form of advanced practice registered nurses. And to become an advanced practice registered nurse for a nurse practitioner, you have to graduate with either a master's, postmaster's, or doctoral level degree after earning your bachelor's and obtain a national board certification. My national board certification is as a family nurse practitioner. As nurse practitioners, we can practice autonomously within our state according to the Florida Board of Nursing within the scope of primary care if we earn the right to do so through furthering our education and our skill set. And for those that choose not to do so, we would be able to collaborate with a physician, whether it be internal medicine, primary care, pediatrics, within a hospital, and to be able to work with that collaborating physician to direct the treatment and plan of care for patients in a myriad of different specialties. So there's a wide array of applications for how we can work as nurse practitioners. Also, as nurse practitioners, no matter what specialty or subspecialty or primary care you're in, we are all diagnosing and managing these patients either autonomously, independently, or with a collaborating physician that we're working with. And when we're taking care of these patients, these are acute conditions, chronic conditions, like people who have high blood pressure, diabetes, obesity, they've had histories of strokes, things of that nature, where we're helping these patients on a regular basis. And also as nurse practitioners, we were first registered nurses, bedside nurses. So as a bedside nurse, you know that educating your patient is such a huge component to the outcome of the patient's success. So as nurse practitioners, we are trained extensively on health promotion, disease prevention, and not only educating the patient individually, but their family that's around them and the community as a whole. So we're definitely huge supporters of education, as with other specialties within the medical community. So when I say community, for me, that community is here in South Florida, and South Florida is very, very diverse. Though I am born and raised here in South Florida, both of my parents are Jamaican. So on the inside, I'm Jamaican, and I identify with many of the Jamaican customs and culture, and I love it, and the people. So growing up, that's what I was surrounded by. And being able to see these patients, I would at times see that the level of care that they were getting, I wanted more for them and they wanted more for themselves. And for me, I wanted to find a way that I would be able to help. And though I may have been the first in my family to graduate from college, I am not the first nurse in my family. My mother has been a nurse ever since I can remember. And just being able to see her and see the impact that she was making on patients' lives really fueled me to want to be able to make that impact and even more, and to further my education to become a nurse practitioner so that I would be the most influential on the outcome of my patients that I served. So when you think of becoming a nurse practitioner, becoming a nurse, ensure that you're doing it with a passion to serve, a passion to teach, a passion to help these patients have better outcomes. Just with any other healthcare profession, if you're become a respiratory therapist, a physician, you have to have the right core of why you're doing it. And if that why is good, then even when the days are really bad, you're still going to know that that's where you belong. Now, for me, the road to become a nurse practitioner started with me earning my bachelor's degree from the University of Miami. I was in a special program. It was a 2+2 joint program between St. Thomas University and the University of Miami. And I graduated from the University of Miami with my bachelor's in science degree in 2010. Subsequently, I started to work a little bit med surg, but mostly emergency room. That was my passion. of nursing specialty was the ER. And I did that for about 2 years, and I earned my certification within the emergency department, and then decided that I wanted to start the process to becoming a family nurse practitioner. And I enrolled in FAU, so Florida Atlantic University, for their Master of Science in Nursing for the Family Nurse Practitioner tract, and I successfully graduated in 2015 and subsequently passed my boards for Family Nurse Practitioner. So I have been practicing since 2015 as a Family Nurse Practitioner. For me, my journey as a Family Nurse Practitioner has kind of spread the gamut. I have worked in an emergency room where I come in and I take report from the other allied healthcare professionals, either physician assistants or nurse practitioners, on their patients, and in conjunction with that, pick up new patients in the ER, assessing them, coming up with my treatment and plan, and then presenting that to the attending physician within the emergency department so that we can agree on a plan for the care of that patient, whether it be x-rays or labs, or if they need suturing, or they need a CT scan or splinting, and then being able to come up with the disposition. So are they going to go home? Are they going to be admitted? Do we need to transfer them? And how to do that as safe as possible. So working in the ER was an amazing experience that helped me gain a lot of understanding about many disease processes, and also allowed me to see how various attendings work. So I was able to pick up really great habits and really great tricks in regards to expediting patient care and understanding disease processes that I may not see every day, or that were more complex than what I learned in school. And that was really a great learning ground for me, and that helped to bolster my confidence and my skills that I use today as a nurse practitioner. So to the other end of it, I then went into primary care. So I went from seeing a patient for a couple of hours and maybe never seeing them again in my life, to seeing a patient, every couple of weeks or every couple of months for chronic conditions that we were managing. And within that setting, I was working with my collaborating physicians to see patients with mostly chronic issues, high blood pressure, cholesterol, diabetes, if they had a stroke in the past, things of that nature, and being able to help them manage that and to have the highest quality of life possible. So that was rewarding in and of itself, to be able to build those bonds and relationships with those patients. And a predominant amount of them were geriatric patients and of Caribbean descent. So it really helped me fulfill one of my purposes of becoming a nurse practitioner, to be able to serve in that community that I was raised in. And that is definitely something that has been impactful for me, and something that I do appreciate to this day. Now, to become a nurse practitioner, please understand that it will be work, it will be challenging. However, the challenge is worth it. And for me, the amount of different settings that you can work in as a nurse practitioner is so amazing, and especially now in light of telehealth and the opportunities that it not only affords to the patients, but also to the providers, is very amazing. And it helps us also with having a good work-life balance, which we have to pay attention to. Mental illness, even within providers, is very, very important. We're people too. So for me, I really appreciate that fact that becoming a nurse practitioner has allowed me to be able to do that and to have that flexibility. So whenever I need to balance things out, it's usually some form of physical activity, a workout class, a walk, a jog, something of that nature, or traveling, are things that I really do enjoy being able to do, to be able to help keep things in check, even on those days when work can get a little rough, because there will be those days when they do get a little rough. So overall, If you are watching this video and you are interested in becoming a nurse practitioner, please understand that it will have its challenges, but it also has its benefits. And if the finances of earning your bachelor's degree, your master's or doctorate may seem daunting, please rest assured that as of right now, there are so many grants, so many scholarships, so many mentorships, even within this channel, to be able to help you to further your education to be able to serve those patients. Right now, in regards to the amount of patients that we have and are expected to have in the future with the amount of physicians and nurses that we have, we're running a little short. So every extra hand on deck is definitely going to be able to help. So please, if this is something that you are passionate about and that you know that you want to do not let the obstacles get in the way of your opportunities. For me, going to school, looking for scholarships and grants was a second and a third job. And it was difficult, but it has paid off. And if I had to do it all over again, I would. So I encourage you, go for it and definitely apply yourself, and you'll see where it will take you.